So testicular torsion. Okay. So there's no other males on this call, I think, but it's an important topic if you're a male. Um, so the definition, it's essentially the spermatic cord twists around its own axis, and that leads to decreased blood flow. So you get venous stasis, arterial flow gets compromised with ischemia and infarction, and then subsequently testicular death. It's the number one cause of scrotal pain in prepubertal males, like this child. Um, it amounts for about 3% of all children presenting to the ED with scrotal pain. You have like a biphasic incident, so before 1 year, and then as a child or the boy enters puberty. Risk factor is cryptorchidism, so undescended testes, a horizontal lie, a bell clapper phenomenon, and then an increased spermatic cord length. The pathophysiology, it's because there's an anatomical defect in the tunica vaginalis, and the testicle then rotates around its own axis as you have cremasteric muscle contraction. This leads to decreased venous return, arterial occlusion, ischemia, necrosis. So it can actually rotate quite significant. Obviously, the longer the torsion, the worse the outcome. If you recognize this within 6 hours, there's about an 80 to 100% salvage rate. Differential diagnosis have a system. So infective is an epididymitis, it's an epididymal orchitis, is it just a traumatic hydrocele, is there anatomical issues, so inguinal hernia, hydrocele, or then in your pubertal males, is this a tumor? So the history, it's very specific. You will see one testicular torsion and you will know it's acute onset severe pain. It's not the male that sits there, it's severe. So 20% of patients can have flank and abdominal pain, 10% of patients have history of trauma. And then subsequently nausea and vomiting. And according to Rosen's, the mean time of presentation, this is obviously Canadian and US statistics, it's about 9.5 hours to presentation, which is a problem. I mean, we already said if you do the surgery within 6 hours, your salvage rate is quite high. So in terms of physical examination, a unilateral tender testicle scrotal swelling. They do teach the loss of cremasteric reflex, but 30% of males has no reflex. The horizontal testiculi. And then I don't know if anyone want to guess the two signs or heard of the two signs, or should I just explain that we can finish up? Okay, right. So the pain sign is essentially where you lift the scrotum and you get a relief of pain. So that's more indicative of like epididymal orchitis. And then the blue dot sign is where you get portion of the testicular appendage, and it forms a little blue spot on the scrotum. Investigations, scrotal ultrasound. We love ultrasound. We should be doing it. It's easy to do. Sensitivity is quite good, and specificity as well. So you'll use the linear probe and you will do what we call a twins view. So obviously the two testicles next to each other. You're going to look for echogenicity, so do they look the same? You're going to also look at the size. You're going to look for, is there any reactive hydrocele? So if you can't do it like this, you can do a split screen on your ultrasound, and when you freeze for one view, you look at the other one and you freeze that, and then you compare. So that's the twins view. Then you're going to move on to color Doppler. So you want to see how's the flow in the testicles. You're obviously going to look at the unaffected testicle first. How's the flow? Remember, just blue away, red towards, and you're going to compare the sides, and then you're going to scan up to see is there flow in the spermatic cord as well, because there can still be a little bit of flow in the testicle, but the flow in the spermatic cord is impaired. And then, does anyone know what we call this sign on ultrasound? Anyone? No one? Okay, it's called the whirlpool sign. So it's indicative of a twisted spermatic cord, and if you see this, it's a torsion. Okay, there's a reported sensitivity of 92% and a specificity of 99% in adults and the non-neonatal pediatric populations. So you can see that spiral-like pattern through the twisted spermatic cord. So what do? You phone the testicle inspector, you give good analgesia, and urology needs to come now. I'm not going to play the video, but I'll post the link. It's a 5-minute video to see how to do a testicular ultrasound on core ultrasound.